but I'm also here as a parent, and I am extremely honored to represent both of us. I'm here because my son passed away 4 years ago from a prescription drug overdose. And I can tell you that nothing in my life prepared me for that moment. My son, Cole, was an incredible young man. He was incredibly intelligent. He was a wrestler. He was a loving brother. He was an amazing son. He was a piano player for 9 years. He had everything going for him. Nothing indicated in his history that he would make a choice like this. In fact, if you look at the 40 developmental assets, he had most of those. So nothing could have prepared us for this moment. In fact, to say that we were shocked, it would be a gross understatement. So what happened? It was 4 years ago this month that a large amount of drugs made their way into our local high school, and these drugs had been prescribed to a woman with cancer. And when she had passed away, her husband didn't know what to do with the medication, so he stuck him in a large box and put him in the back of a closet. And for various means, we don't exactly know how, they were stolen and brought into the high school, and two young men distributed them on a Thursday morning, and quite a few students had taken them that day. But my son didn't get them on a Thursday. He received them on a Friday afternoon. He went about the rest of his day, and that Friday evening, when I picked him up after wrestling practice, a little bit later that night, I noticed that he was under the influence of a narcotic. So my husband and I took him to our local emergency room, and despite asking very pointed questions to our doctor and having him reassure us on multiple occasions, we were told that he was out of the danger zone, and we were sent home. So thinking that the very best course of action for my son, we all went to bed thinking that he just needed to sleep off the effects of the drug. Just a few hours later, when we went to wake him up, we found that he had passed away instead. An autopsy and a toxicology report showed that Cole had taken just one pill, just a single dose, a one-time injection, ended his life. This one bad decision absolutely shattered my family. And I would love to be able to stand up here today and tell you that this is an isolated event, but it's not. What happened to my son happens all the time. Every single day in the U.S., 120 people die from a drug overdose. We know this. We know the statistics. We see it every day on the news, and we read about it in the paper. Now, I'm going to jump on my soapbox here because obviously with my family's history, this is something that's very near and dear to me. I think that we've gotten away from the message. Back in 2011 when this happened, it was called the opiate epidemic. And we were told to get rid of all of our unused and unneeded medication. And we did a wonderful job of that. We passed out the prescription drug drop boxes. They showed up in the law enforcement agencies. And we cleaned out our medicine cabinets. And we did a really good job of that. But I think that we stopped. And I'm going to put things in perspective. Every single day, 7,800 people try an illicit drug for the very first time. Every single day. And of those people, over half of them are under the age of 18. Now, of the drugs that they take, 1/5 of those will be a prescription drug. And this is very important to note because statistically, the history shows that 19 of those drugs, people that take non-prescription or prescription pain pills, they are 19 times more likely to try heroin. And of the heroin addicts that are addicted, more than 50% of them started with prescription pain pills. So that link between the pain pills and heroin, it's irreversible. It's irrevocable. It cannot be broken. But that's not what we're seeing in the news anymore. Back in 2011 when my son died, that's all you saw about. Today, we're not seeing it in the news. We hear about heroin, and absolutely we should hear about heroin. It is a scourge. It's killing our people. Yes, but we don't hear about the pills. So I think that we patted ourselves on the back and we said, good job. We can unlock our medicine cabinet. We can put our guard down, but we can't because we have not done the job. So I'm going to step off my soapbox now, and I'm going to put on my hat for the Attorney General's office because I was also asked to to share what we've done collectively in the office. And so in the past few years, the Attorney General has revoked the license of 15 pharmacists and 61 physicians who have improperly prescribed or dispensed medications. And that's huge. It is not an easy task to revoke the license of a physician. And of those physicians, 51 of those licenses were permanent. That's a very big deal. In partnership with the Ohio Department of Health, it was ODATIS, but now it's Ohio Mental Health and Addiction Services, and Drug-Free Action Alliance, the Attorney General's office purchased 67 of the prescription drop boxes, and they distributed them throughout the state, and more than 26,000 pounds of unneeded medication have been disposed of. And the Attorney General also has awarded $10.7 million to the DARE program. And I want to take a moment because I know that this tends to be a little bit of a divisive issue, because when you talk about DARE in a community, people are like, oh, DARE doesn't work. But that's the DARE of the 1990s and the 2000s. DARE today is very different today. One of the very first things that the Attorney General did was he mandated that anyone who is receiving a funded program implement a prescription drug abuse prevention lesson, as well as if you were doing a curriculum, you had to use an evidence-based curriculum, and if you were not, you had to go before a DARE review team, and you were provisionally accepted if it met certain criteria. And this next year, if it's not a evidence-based curriculum, you don't get approved. So what was happening in the past, it's not that way. So what is being done now, what is being taught to your children is absolutely evidence-based, because prevention is a science. The Attorney General, in conjunction with the Governor Kasich, held a heroin summit in which over 40 schools came together to learn about what they can do and how they can address their population and offer practical solutions. He also held 13 town halls across the state to find out what is and what is not working in the communities, and I'll tell you a little bit later on how that is able to help your community here. He also organized a coroner's review. One of the biggest challenges was getting information from the coroners. How do we really know how many people die daily? And how do we know how many people are dying from heroin when we don't have standard reporting? And when not all 88 counties are reporting on overdoses, especially in relation to the opiates. There's been a very big push for training and education, extensive training for law enforcement, but also he produced a naloxone training that's not just for law enforcement, but for anyone who is interested, because it's not just for law enforcement, it's for lay people as well. And just recently, he petitioned the manufacturer of naloxone for a $6 rebate for anyone who was law enforcement and other dispensing agencies. So what are we doing now? The biggest part of what our agency is doing, what our office is doing, community outreach, is we are actively engaged in the communities, because we realized that it's not going to be solved, this problem is not going to be solved from a federal level, it's not going to be solved at the state level, it's going to be solved at the community level. It's going to be solved in rooms here. It's going to be solved with people like you. And so Attorney General Mike DeWine knows that. He stated at one of his meetings, and he's incredibly smart man, he said, we're not going to legislate, we're not going to prosecute our way, and we're not even going to treat our way. The way we're going to solve this problem is we're going to have to prevent. We're going to have to come together, all of us. Every sector of society has to come together. So one of the things that we do a lot of awareness events like this. But one of the things that we do, we hold community meetings. And in those community meetings, if there is an interested community, we will go there and we will invite, we work with a group that invites us. And we'll send out the letters with the Attorney General's headline. Letterhead, there we go. To the people that have been identified that are the movers and shakers of the community. And it's amazing how people respond when you have the AG's letterhead on that, rather than just an interested party like myself. And so we get them together. And the really important thing for this is that we facilitate the meetings, and the community is the one that develops their own strategic action items to identify what they want to accomplish in their community. And we're only there to help connect the dots on the resources that they already have, as well as to facilitate those from the state level and to bring them down. Because we've been in communities that say, well, we need this, and we need this. They didn't realize that when you bring everybody from the community together, they already had it there. They just didn't realize. And so that's something that we as an organization are able to do. And so that's something that we are doing currently. And as far as what we plan on doing, we're going to increase our focus on staying at the grassroots level, because that's where the success is. That's the key. And in summary, our goals are simple. We have two. One, we need to keep people from dying. And two, we need to keep people from becoming addicted.
I'm going to stay sitting. Is that all right?